add up all of the people with diabetes, heart disease, and cancer, and according to the American Academy of Pain Medicine, there's still not as many of those of us suffering from chronic pain. But you don't have to be one of those 100 million Americans dealing with that right now. We are with Dr. Khan from Wasatch Pain Solutions, and you truly have just that, a solution that's different pretty much from anyone else in the state.
Yeah, so we're part of a group of physicians, elite physicians in the world that kind of do stem cell therapy. It's called Regenexx, is the type of stem cell therapy we're doing. What makes us kind of unique to a certain degree is we have a lot of the research that most of the physicians out there that are providing these types of services are quoting. So over 50% of the world's research is being done here in our Regenexx network clinics. So things that tell people what types of treatments are going to be right for them, we're the ones that are providing that type of care.
So we're talking about stem cell therapy, and I think it's interesting because, as you mentioned, we are starting to see some of those clinics popping up and advertising with that, but Regenexx is very unique in that it's different. How so?
First of all, our mantra is that we want medical physicians to be able to provide this service. So these are physicians that have been deemed to be medical doctors, so MDs, or doctors of osteopathy, DOs. Those are the only two physicians in the country that can actually be licensed to practice medicine. So that's your basic minimum. Then from there, looking at your specialties to make sure you're trained in orthopedics, sports medicine, physical medicine, rehabilitation, maybe doing additional accredited fellowships, and then on top of that, a vetting process in which application, interview process, training, proficiency training, which is a big deal because these types of procedures are specific for specific conditions, and you want to make sure the patient understands where you're placing that needle or where you're placing those stem cells are going to make it to those tissues you want to go to.
Let's talk about that for a minute. What are the majority of the areas you're treating, and who are your patients?
So our patients are active elderly patients. They tend to be active, generally patients, so patients that like to play sports, patients that like to run, patients that like to ski, patients that like to hike. So there are a lot of people that are very active, and they want to maintain that activity as they grow, as they age. And so those are most of our patients, and that's where we are.
And their most common areas that you're treating would be what, like joint pain or what
Joints
else?
are the number one cause. So knees are big in a lot of people. Shoulders are another one. We see a ton of spine issues, so a lot of people have neck and back problems. Then we do a whole host of other smaller joints like your wrists or your ankles or your thumbs, etc.
Yeah, no, that back pain. I mean, that's something that I struggle with, and it's hard to find something that helps for a long period of time. How long would you say most people take to start feeling better after Regenexx?
Well, from the platelet therapy is usually 3 to 4 weeks. From stem cell therapies, it can take a few months fully to heal. So usually after about 3 to 4 weeks with the platelet injection, people start to notice an improvement.
So much good information. They are qualified, they're capable, and they do genuinely care about their patients. This is Wasatch Pain Solutions, and all of their information, including their phone number, right there on your screen. So go and schedule your appointment. Dr. Khan, thank you so much for coming in.
Thank you for having me.
Love what you're doing and love that you're so passionate about that.
I am.
You know what else I love